Good afternoon, everyone. Again, we welcome you to another webinar. As we have always been doing, we have been conducting seven webinars that are very relevant and webinars whose topic are your choice. So for this time, we decided to come up with this very relevant topic, and it's all about COVID-19 vaccinations, especially at this time that our numbers are increasing and people are really getting tired of all the restrictions and all the safety protocols. So getting the vaccine or not getting the vaccine is something that is on top of mind among people, especially here in British Columbia. So for today, we are lucky to have an expert talk about the COVID vaccines. So I would like to introduce to you Joy Abasta. Joy Abasta is actually based in Vancouver, Canada, but currently in the Philippines right now, doing some research work for the WHO, still in connection with COVID-19. But before migrating to Canada, she was a registered nurse in our home country in the Philippines. And she completed her degrees in Bachelor of Science in Nursing, Master of Nursing, and Master of Education before the age of 24. Very young, di ba? Quite a fit for her age. And throughout her decade-long healthcare career, she was a nurse, a researcher, a community worker, and a health writer, all into one. When she moved to British Columbia, she started as a care aide. And then eventually she became a coordinator, and then a palliative care supervisor, and now a full-time Master of Public Health student at the Simon Fraser University. She is also a teaching assistant in the Indigenous Studies of the said university in Simon Fraser. As we all know, the current global pandemic, COVID-19, showed how the people in BC and across Canada, and in fact the whole world, are significantly impacted by this challenging virus. So we at Success, with the help and support of Joy, hopes that this webinar can provide some clarifications about the virus and the readily available vaccines that we have here in British Columbia. So without so much ado, I'd like to turn you over to Joy Abasta. Take it away, Joy.
All right. Thank you, Mandy, for that wonderful introduction. And first of all, I want to thank everyone for taking the time to be here attending this webinar. I appreciate everyone being here, and also for Success for hosting this webinar. We've been planning this since February, I think, and thank you so much again. Before I share my screen, I wanted to make sure that everybody can understand Tagalog. So does anybody only speak English, or can I speak in Tagalog as well?
You can do both.
Yes,
Okay.
Tagalog. Yes.
Tagalog and English. Because gusto ko po, ang mangyayari po dito is, gusto ko po maintindihan nating lahat yung information about COVID-19. Gusto ko po kung may tanong kayo, don't hesitate to ask me questions, and I will do my best to answer them. At saka, ang masasabi ko po is, I won't give you answers that I'm not sure about, but I can give you resources that you can call, or maybe you can go to a website para ma-clarify natin or ma-confirm natin yung information na hinahanap niyo regarding questions. So let me share my screen right now. Here you go. Share my computer sound. There, can you see my screen?
Yes.
Yeah? Okay.
Yes.
So our topic, thank you. Our topic for today is defeating COVID-19 through vaccination. So again, it's hosted by Success, Immigrant Settlement and Integration Program in Surrey. All right. So katulad ng lahat ng physical organizations or physical meetings natin, we do have our land acknowledgement. So we acknowledge that Success Immigrant Settlement and Integration Program in Surrey, BC, Canada sits on the unceded Coast Salish territories. These are the traditional lands belonging to these First Nations. So Coast Salish, Katsi, Tsawwassen, Coquitlam, Stolo, Waishanik, if I'm not mistaken with the pronunciation, Kwantlen, and Suminas. So we are cognizant of the privilege and responsibility of gathering, living, learning, and playing on sovereign and unsurrendered Indigenous lands. So before we go on with COVID-19 webinar, gusto ko pong maintindihan nyo bakit ba natin kailangang gawin yung land acknowledgement. Kaya po nasabi ni Ma'am Letty kanina, teaching assistant po ako ng Indigenous Studies. So gusto ko pong maintindihan natin lahat why we have to do this. So very short description lang po. It was because in 1500s, parang katulad din po dito sa Pilipinas, na-colonize po tayo ng mga Spaniards, pero po sa Canada, meron po tayong tinatawag na Indigenous peoples, First Nations people. Sila naman po ay na-colonize ng mga English people, yung mga people from UK, kung nasa po may mga kings noon. And then, mas grabe pa po yung nangyayari sa kanila kasi nagkaroon po ng genocide or yung sinasabi po nilang papatayin nila lahat ng Indian. Or kung ayaw nilang maging Kristiyano, mamamatay sila. Yan po yung naging genocide effect. Tapos hanggang ngayon po, meron tayong tinatawag na Truth and Reconciliation Commission na ang ginagawa po ng Government of Canada is tinatry po nilang ma-restore yung culture na nawala sa mga Indigenous peoples. Okay po, next. So, a little bit more information po. If you want to know kung ano po yung mga First Nations na kung saan po kayo nakatira, you can go to native-land.ca para po malaman nyo kung ano yung mga nations. Nilagay ko po dito yung isa sa mga address ng Success sa Surrey. So, ayan po, yan yung nakikita nyo dito, contact local nations, Coast Salish, yan po yung in-acknowledge natin kanina. And another one is the language that Coast Salish peoples speak is called Hulkaminam. So Hulkaminam, konting-konti lang po ang nagsasalita niyan, so they're trying to restore that language. Okay po? So next na po tayo. So hindi na po ako magsasabi ng marami about myself, but right now, currently, nasa public health po ako. As what Ma'am Letty said, I'm currently in the Philippines. I'm doing a COVID solidarity vaccine trial work with WHO and the University of the Philippines, PGH. I'm also a master's student at Simon Fraser University. Social media accounts, meron din po yan sa dulo mamaya. We can talk about that later. And also, kung nakikita niyo po sa pangalan ko, nakikita niyo po yung aking baybayin name. Yan po yung baybayin name ko, which is called Ligaya. And my pronouns are she and her. So, nagtataka kayo siguro why are you seeing mangoes in here? Right? May tatlo kayong mangga na nakikita. Mayroon po tayong game before pa tayo magsimula. So, we're gonna play. So, you have to guess how many mangoes there are in the entire presentation to win a prize. Okay po? So, how many in the previous slide? Ilan po? Tatlo, di ba? May tatlo na po tayo. Tama po. Tapos, with this slide,
dalawa.
So, may 5 na po tayo, right? So, what you have to do, what you have to do is you have to be really focusing on the slides. Sorry, hold on lang po ha. Medyo, excuse me po, sorry. So you have to guess how many mangoes there are in the entire presentation. So we will have 1 to 3 prizes depending kung tama po yung nasagot nyo. If there are multiple correct guesses, we will do a draw. Okay po? So right now with this slide, we already have 5 mangoes. Okay, so points for discussion. Quick recap lang po about COVID-19. Gusto ko lang pong magkaroon tayo ng konting story time about pandemic and saan ba nanggaling yung quarantine. Tapos, we're gonna talk about COVID-19 vaccines, yung immunization plan schedule, the variants, and then ito na nga po, frequently asked questions. I have a lot of questions na inilagay dito. So I'm hoping na some of them will be answered kung meron po kayong burning questions in your mind, sana po makatulong itong presentation na ito. And then at the end, we were going to have our question and answer open forum. Okay. So, ito po, this is the British Columbia COVID-19 dashboard. As you can see, nilagay ko po dito yung mga important things to see. This was taken yesterday, or was it yesterday, April 16th? Yeah. No, that's today. Today in Vancouver. So today, April 16, 7:30 in the morning, today's new cases, meron po tayong 1,200. So last night, according to the news, kung ganito po kabilis dumadami yung cases natin, projections show that COVID-19 cases can hit 3,000 per day. And that's a lot. That's already a lot, and that's very alarming. But then you can see dito po sa bottom left is that the total vaccine doses administered in BC is about 1,235,863. So later on, we are going to delve more into that kasi po kailangan nating malaman ano ba yung herd immunity? Ano ba yung kailangan gawin ng society or ng community natin para magkaroon ng sapat na immunity for everyone, para ma-stop na yung pandemic, okay? Okay, so about COVID-19, this is the 5th pandemic since 1918, since Spanish flu. So basically 1918 po, yan ang start ng modern world. That was the start of World War II, or end of the First World War, sorry. So, konting story time muna tayo ha. So, meron na po tayong 5 pandemics. So, the first one was Spanish flu, na nanggaling nga po sa First World War. Daming namatay na Americans. And then, nag-end siya kasi namatay na yung mga soldiers na galing ng Spain or nagkaroon sila ng immunity. The second one is the Asian flu. Galing siya ng, I think that was galing ng Japan or ng Hong Kong, and then nag-migrate sa China. And then there was a first wave, about 100,000, and then the second wave, bigla siyang nag-blow up to about 1 million na namatay, sorry. And then the third one, I think this is very popular with everyone, I think. This was also in a movie with Queen. So the third one, kung sino po yung mga nakapanood ng Bohemian Rhapsody, can you remember kung ano po yung fundraising na ginawa nila? Para saan po yung fundraising na ginawa ng Queen and the other musicians at the time sa UK?
AIDS ba yun?
HIV/AIDS po, tama po kayo. So the third pandemic is HIV/AIDS. As of current, wala pa rin po tayong gamot dyan. Meron po tayong yung parang tinatawag nila na antiretroviral, pero it doesn't cure. It only reduces yung transmissibility ng ng HIV. And then the fourth one was in 2003, yung po yung first SARS. So 2003, yan na po yung start of the millennium. Nung nagkaroon po ng SARS, doon din po nag-start yung Public Health Agency of Canada because nakita nila bukhang ang projection, magkakaroon ng pandemic again. So Canada wanted to be more prepared, more ready. And then after 20 years, here we are. Almost 20 years, meron na naman po pandemic, and that's the fifth one. Yan na po yun. Sorry, yan po yung COVID-19. So again, originated from bats, started in December 2019, first reported in Wuhan City, Hubei in China. And alam natin lahat, droplet transmission. So lahat po na kapag lalabas tayo, we have to put our mask on. Kung here in the Philippines, you have to put your mask and your face shield. And then also, you have to do social distancing, at least 6 meters or 6 feet or 6 meters away. So timeline natin was declared as a public health emergency. And then because of the racial discrimination, in February 11, 2020, WHO declared it as COVID-19. Finally, March 5, 2020, first case in Canada was detected in British Columbia. As you all know, YVR is one of the international hubs dito po sa Canada. And then March 18, 2020, if you can remember, that was, sort of our lockdown version sa Vancouver or sa BC. And then, mabilis lang. By December 2020, meron na ang vaccine. Nag-start na yung rollout in phase 1. And then right now, vaccination and immunization plan is ongoing. So who can tell me kung anong phase na po tayo ngayon? We have 4 phases. Nasa anong phase na po tayo? Anyone?
Sir?
Tama po. So
Phase
we
3.
are now on phase 3. Tama po.
Salamat. Kuha mo akong
So,
tubig.
alam na po nating lahat to, fevers or chills, cough, loss of sense of smell, difficulty or breathing. Yan pong key signs and symptoms. Pero ang mas nakakatakot with this pandemic is that it is asymptomatic, especially with the relatively healthier aged people. So basically in our brackets, so younger children, young adults, mid-adults or middle-aged adults, minsan asymptomatic tayo. Kaya ang nangyayari is hindi natin alam na nakapag-transmit na tayo ng virus dun sa mga lolo at lola natin, which is bad because a lot of them are dying. So alam na po nating lahat yan. We do know what to do with hoping to prevent the COVID-19 spread in our community. Ang idadagdag ko lang po dyan is getting vaccinated. Okay po? Yan po ang pinakamabisa ngayon na pwede natin gawin. But then of course, getting vaccinated is a personal choice. Nobody can force you or coerce you to get the vaccines or get the shot. Kasi parang, what if you are scared, or what if you need more time to decide on if you're gonna get a vaccine or not. That's okay, and you have the right to have that. So why did it become a pandemic? So again, it's a new viral disease with no known cure. So there still is an alarming levels of inaction. So Dr. Tedros, that was said by Dr. Tedros, who is the WHO president. So noong 2020, kung nakita niyo po yung nangyari sa Spain, marami pong namatay na elderly. But then right now, it almost feels like even with the vaccines, the problem is that sometimes their rollout is so slow, especially here in the Philippines. It's very alarming that we have 12,000 cases per day and their rollout is very, very slow. So the third one is global travel. So this is the age and era that everybody wants to travel. So can you imagine the exchange of air and droplet transmission is just exponentially blew up because everybody wants to travel. And then urbanization, overcrowded cities and limited public resources, especially kung nasa developing countries ka. And then the fifth one is healthcare services and professional shortages. So British Columbia is very, very good with allocating their resources. My practicum last year with public health was with Fraser Health. So with Fraser Health, they have their meetings every day just to talk about allocations. If we think about it, yung mga masks, mga, kahit mga panglinis sa hospitals, they talk about it because they want to spread it or they want to optimize everything na hindi nako-compromise in quality of care. But then if you can see, kung meron po tayong kamag-anak dito sa Pilipinas, there is a shortage of healthcare services and professional shortage. Even if you have the money in the world, if there is no service or there's no mechanical ventilator for you or there's no ICU bed for you, you're gonna die in the hallways, which is very, very sad. So kaya po siya naging pandemic. Is there any questions so far po? No one? Okay, let's move ahead. Okay, so I did this exact same webinar last month with the Philippine Consulate General in Vancouver. So ganito din po, nag-webinar kami. Ang sabi ko po noon is, this is according to WHO. Total cases in the world as of March 6, 2021 was 115,653,459. And then kanina, tiningnan ko ulit, ilang cases na ba ngayon meron sa COVID? Right now, it's 138 million. 138.4 million ang nag-COVID positive. And I do know that in one way or another, we know someone, a family or a friend that had COVID. Unfortunately, some of them passed, but we're going to talk about that later on. So just in a matter of 1 month and a bit, nagkaroon ng 22,758,000 cases, added cases. So ganun siya kabilis mag-spread out globally. And then let's talk about deaths. Last March, it was 2.5 million. Right now, it's close to 3 million as of April 16, 2021. Imagine 3 million people lost their lives. And 3 million people, that means 3 million families as well. So that's why it's pandemic. Hindi lang po yan physical, hindi lang viral. It's also our mental health and emotional health na naapektuhan kasi it feels like we can't do anything about it and we can't even go out of our homes. So I do know that this pandemic took like a big toll, a heavy toll on every one of us with the lockdown and, you know, friends passing away. But I'm hoping that everyone can learn from this webinar again. So it is a pandemic as well because out of 255 countries and territories around the world, ang naapektuhan is 223. So that's, I don't know, that's more than 85%. So let's talk about vaccination. So vaccination, total vaccines in the world, 734 million. Out of almost 7.8 billion in the world. So that's about, 9.8% na nava-vaccinate pa lang, nababakunahan pa lang. So do you think that's enough to have herd immunity or to stop COVID-19 from spreading? I don't think so, right? Kasi hanggang ngayon, takot tayo eh. Even in the Philippines, 12,000 cases. In BC, British Columbia alone, projection is 3,000. So kahit na-vaccinate tayo with 9.8% vaccinated people, it's not enough. So this is just to show you kung ano yung mga cases right now with in Canada. So it looks like Quebec has the highest death rate, in Ontario, Alberta, and then the fourth one is British Columbia. Ito na, I do have a question. What is herd immunity? So ang sinasabi dito, I just got this 2 days ago. At least one dose ang nakakuha. All of Canada, 8.3 million. And I think our total population is 37 million. And then fully vaccinated is 854,000. So a percentage ng mga na-vaccinate, 22.2% plus 2.3. So about, let's say, for example, 25% yan. Can someone tell me kung may nakakaalam po kung ano ibig sabihin ng herd immunity? Narinig nyo na po yan before or ngayon nyo lang po narinig? Anyone po from the attendees? Huwag na po kayong mahiya. Okay po. So herd immunity, ito po yung sinasabi na halimbawa sa isang community natin, may sapat na percentage ng mga tao na nabakunahan na. Para kung halimbawa yung iba na hindi pwedeng mabakunahan, hindi sila agad maapektuhan or hindi siya mag-spread sa buong community at hindi na siya magiging pandemic. So ang herd immunity, magbibigay po ng example mamaya. Pero sa COVID-19, we need at least 70% of people in the world to be vaccinated para magkaroon tayo ng herd immunity. Kasi kung may nakikita po kayo na, ito yung example nakikita ko sa social media, may nakahilera na posporo. Di ba po? Lahat yun hindi pa anong tawag dyan, nalalight up. And then pag nilight up mo siya, lahat sila. Tapos, dire-diretso silang ganyan. Dapat pala nilagay ko dito. Dire-diretso sila. Lahat mahahawaan, lahat masusunog, di ba? Pero kung halimbawa yung isa itinaas mo, or ibinaba mo actually, baba na lang natin. Baba natin isang posporo. Pagpalagay natin yung posporo na yun, nabakunahan. Yung posporo na yun nabakunahan, tapos nilight up mo ulit yung panibagong batch ng ng posporo, hindi na po mag-spread yung sunog or yung burn kasi may isang nakabakunahan. Pero minsan sa laki ng sa laki ng posporo or sa laki ng light ng burn pa rin, nahahawa pa rin yung iba na dapat magkalayo na pero nahahawa sila kasi malaki yung malaki yung burn. So kailangan 70% magkaroon ng immunity. Para po, say for example, sa mga bata, chicken pox. May tinatawag na yung ibang mga nanay, ayaw nilang pabakunahan yung mga anak nila, which is okay. Not okay scientifically, but it's their personal choice. With that, hindi rin, mas may chance na hindi magkakaroon yung anak na hindi nabakunahan because yung mga kaklase niya ay nabakunahan. Okay po? Yun yung ibig sabihin ng herd immunity. So, balik po tayo dito sa dashboard. If you can see, ang nababakunahan pa lang is 1.2 million dito sa British Columbia. And I guess, if I'm not mistaken, our population is about 5 million, British Columbia alone. Please correct me if I'm wrong, but then it's not enough to stop the pandemic. Kung makikita nyo rin po dito sa may bandang gitna, distribution by age, ang marami po, nakikita nyo rin po sa news, ang maraming na-apektuhan or maraming nag-COVID positive is yung mga young adults, 20 to 29 years old and 30 to 39 years old. Kung napansin nyo po siguro about 3 weeks ago, medyo may narinig po tayo kay Premier John Horgan, sinasabi na please do not, for those 20 to 29 years old, please do not go out so we can stop this pandemic. Please do not ruin it for us. But then, medyo itatama ko lang po yun kasi usually 20 to 29 years old, they are working and usually it's their first job. And sometimes if they're immigrants and they're alone here, they have to work because nobody can help them out. At saka po, historically, at saka with data statistics, usually mas marami yung mga mas bata kaysa sa matatanda. Kaya po, paliit ng paliit yung mga cases natin habang tumatanda yung age bracket. Okay? So, let's go to COVID-19 vaccines. But before that, may tanong po ba tayo? Wala?
Meron akong tanong.
Hindi po.
Yung
Marie.
kay Joy, oo. Meron akong tanong, meron ka bang data regarding sa distribution per city dito sa BC para makita natin where we stand as regards herd immunity?
With the dashboard po, wala pa po tayong ganyang data because as you can see po, parang wala pang 10% yung nababakunahan. But I think, I'm hoping before the end of the year, meron na po tayong ganyang data. But you can go to this British Columbia COVID-19 dashboard kasi po kung makikita niya dito sa baba, meron po yung mga tabs. Kung may gusto po kayong makita ng mga ibang data, meron pa po dyan. But as far as I know, wala pang about herd immunity. Okay po?
Thank you.
May ano po kayo? May follow-up question?
Kasi inisip ko kung ang ratio natin is 1.2 to 5 million. So about 24% or 25, close to 25%. Is this in BC o tama in BC alone? So kung i-ratio natin by city siya, iba-iba kasi ang population by city, no? Gusto ko lang kasi makita kung meron tayong herd immunity as to city dun sa mas konting population na city.
Paki-clarify po kung ano yung city.
Yes, for example, Delta, Surrey, yung mga ganon.
Oh,
Yung mga city covered by BC. Kasi buong BC kasi itong 1.2 million. So kung i-break natin, kung makakakuha tayo, para lang ma-assess natin kung merong herd immunity dun sa mga city na mas maliit ang population, mas merong kumpiyansa o hindi man kailangan magiging lax, di ba? Pero makita lang natin na sa isang city pala mas marami nang na-vaccine somehow. Since maliit ang population nila, technically nagkakaroon ng herd immunity dahil konti lang naman sila, di ba? Kung ganun. Pero tama nga na since 1.2, maliit naman talaga siya. Pero kung dahil kasi ang BC, di ba, malaki naman ang land area. Pero kung sa population, kaya interesado na ako as to the number, yung i-break ng city. Para lang makita natin ano yung mga na-prioritize ba na city at kung yung lower ba na city mas meron silang protection technically, diba, pagka pinag-usapan natin yung herd immunity. Yun.
Thank you so much for raising that up. Sorry po, hindi ko po tinignan siya by city, but basically po, for everybody's information, ang British Columbia po nahahati according to health authority. So, kung nakikita nyo po dyan, may Interior, Fraser Health, Vancouver Coastal, Vancouver Island, at Northern Health. So, ang alam ko po is with Fraser Health, yan po ang hotspot sa BC. Yan po lagi, ever since noong 2020 pa, practicum pa lang po ako. Yan na ang may pinakamaraming cases. Mas marami pa sa Vancouver Island. So, marami po kasing tao sa Fraser Health. So, ano po ba yung cities na meron sa Fraser Health? Fraser Health composed of New Westminster, Delta, Sur, Maple Bridge, I think hanggang Abbotsford yata. Yan po ang cover ng Fraser Health. Sobrang laki. Kaya hotspot din siya. And then, I think po, I wasn't able to go to the one by one with the dashboard. Kung makikita niyo po dito, on the top right corner, meron pong filter dashboard values by health authority. So, I suggest po na highly encourage you to visit this dashboard for your own information to check kung nasa na po ba tayo, ano na bang level na natin, vaccinations natin. And para makita nyo din kung ilan ang cases per health community or health authority. With Vancouver Coastal, gusto ko lang din pong malaman ng lahat kung ano po yung mga cities na covered ng Vancouver Coastal Health. With Vancouver Coastal Health, obviously it's Vancouver City. Kasama din po yung North Vancouver, West Vancouver, Richmond, although nasa southern part siya, it's still part of Vancouver Coastal. And I think with Whistler as well. I'm not sure with Whistler, but Squamish is Vancouver Coastal Health. So, yan po. Thank you again, Ma'am Maria, for that question. But then again, I want everyone to visit this dashboard for everybody's information then. Kasi it's pretty easy to navigate. It's also pretty simple. Mukha lang siyang overwhelming at first. But once you go ahead, you can take a look and pwede niyong pag-aralan kung nasa na ba tayo ngayon with regards of COVID-19. I think Sir Fred was raising his hand. May tanong po kayo.
Joy, excuse me, there are people who have raised their hand. So siguro, bigyan natin sila ng opportunity to ask question. Yung mga naka-raise ang hand, let me just check, no? So, ang nakikita ko lang dito, I cannot even see sino mga naka-raise ang hand. Anim na yung naka-raise ang hand.
Pero, tapusin muna natin kasi naka-recording siya.
Okay, sige. So,
mas maganda siguro tapusin muna.
Yeah, okay, Masi, we will have to finish muna daw bago. We'll have to finish before entertaining questions.
Yeah. So let's finish with all of this. Sorry, I forgot about the recording, and then hold up on your questions. Then let's talk about it later on the open forum. We have About an hour, 10 minutes. Okay, let's move on. So COVID-19 vaccines. Currently available options. Meron po tayong 4 na vaccine sa Canada. So we are currently in phase 3. COVID-19 vaccine brands. Meron po tayong Pfizer or BioNTech vaccine, Moderna, AstraZeneca, and Janssen, Johnson & Johnson. So gusto ko lang po palang sabihin that across the world, there are a lot of vaccines going out. Here, may Sinovac sa Pilipinas, but not in Canada. So we're going to talk about why it's like that. Even Russia has Sputnik, and then Canada doesn't have that yet. So for everybody's information, these are free. Well, technically, it's not free because it is government funded. And it is from the taxpayers' money. So that's how our health insurance works. So yeah, you don't have to pay anything about getting the vaccine. Here's what you need to know about vaccines. Only vaccines that are safe and effective will be approved for use in Canada. So again, maraming vaccine available. Here in the Philippines, there's about 8. But then in Canada, because it goes through a thorough process para ma-approve for distribution, it has to be safe and effective. And then a vaccine will be available to everyone kahit wala kang MSP number or personal health number, or kahit turista ka na stuck sa British Columbia. Because there will be limited quantities at first, once a vaccine is approved for use, key population will need to be prioritized, which is true, right? So mayroon tayong phase 1, phase 2, phase 3, phase 4, and then nagbago siya because a month ago, kasi nagkaroon ng research na the first dose will be effective for the next 16 weeks. Kaya napapabilis yung rollout with the age brackets. Building up immunity takes time. It takes about 2 weeks for your body to have that full protection about COVID-19. And again, vaccines will be free. Vaccination is a choice you should make to protect yourself, your family, and community. And the government of Canada is committed to working with Canadians and keep everyone informed. Kaya po, yung AstraZeneca na may problema, clinic out for people ages 55 and below. Sorry, na doble yata ito. Yes, na doble. So the federal and provincial government of Canada, sorry, pero isama nyo tong mangoes pala dito. Okay, so the next one, the federal and provincial government of Canada are committed to working with Canadians and keeping everyone informed. So maraming information that's available on social media, but I highly encourage everybody to go directly to the source where you can get your accurate information. So if you want the global information, you go to World Health Organization. If you want to see kung anong meron sa mandate ng Canada on a federal level, you go to Public Health Agency of Canada. If you want to go to the provincial level, you go to, may tatlo yan. So BC Center for Disease Control, so BCCDC, yan ang pinaka-hub natin or pinaka-center natin for all the updates na nangyayari sa British Columbia about COVID-19. And then kung may questions kayo, you can go to Immunize DC. There are a lot of question and answer portion there. I love going to that website kasi ang dami mo matututunan. And then this one, the second one, or the last one, for latest updates and vaccine schedules, I get everything from the British Columbia government website. So pwede nyo na lang i-Google BC government COVID-19, or this is the link if you want to get that. Meron silang services and information topics, including vaccination and immunization schedule, mga travel information nyo din, and then meron silang translated content in 12 languages, including Tagalog. So a lot of information from the government website. So I added this because sometimes there are adverse effects from allergies. Meron tayong minsan na naririnig na severe adverse reaction. kapag nangyari yun, ganito ang magiging switch on ng system natin. So, syempre ikaw na nabakunahan, tatawag ka dun sa pharmacy or dun sa clinic or dun sa medical doctor mo. Sabihin mo, oh, mayroong nangyari. I don't know if this is my side effect. Tapos kapag nakita nila na, oh, this is not a usual side effect for vaccines, katulad ng nangyari sa AstraZeneca, meron tayong tinatawag na VIPIT or blood clot or thrombocytopenia. Malamang mayroong mga nagsabi niya na, okay, ito yung side effect ko. So yung mga doctors mo, pumunta sa provincial level, pumunta sa BCCDC, ni-report nila yan. May system yan. And then kapag ka napatunayan na may problema talaga, they go to the national level, which is the CAE FIS, and then they report to World Health Organization on the global level para malaman nila na, huy, ito pala yung nangyari sa AstraZeneca. So, kung nalaman nyo with Europe, sa Europe nang unang nangyari ito, that with AstraZeneca, the side effect was thrombocytopenia or blood clot, mostly with women, 55 and below, but this is very rare. Although it happens, it's very rare. It happens to about 1 to 10 women I believe, in 1 million. So let's talk about the kinds of vaccines. So, lagi nating naririnig Pfizer and Moderna. 2 vaccines being used in BC as of March 6, 2021. It's still being used right now. Parang magkaiba sila ng type with magkapara sila, Pfizer and Moderna, pero magkaiba sila from AstraZeneca, and then iba din yung sa Johnson & Johnson. So, before, noong March 6, 2021, ang sinasabi is 2 injections, kailangan matapos mo yung second dose mo 21 days apart with Pfizer. And then with Moderna, it has to be 28 days apart or 4 weeks apart. But since March 5, 2021, nagkaroon nga ng panibagong research na, pwede pala tayong maging covered ng vaccine or immunized ng vaccine for about 16 weeks or 4 months. Kaya napabilis nga yung rollout ng vaccine with age range. Yan. Tapos how effective? 90% with Pfizer, Moderna is 95%. Yes, mayroong 5% discrepancy, may 10% discrepancy. So far, this is the best one. But I'm going to talk about the efficacy rate with AstraZeneca kasi medyo mababa siya. Pfizer, you have to store it negative 75 degrees Celsius. Moderna, negative 20 degrees Celsius. So a little bit of information. Sa Canada, storing Pfizer is okay because malamig sa Canada. But in the Philippines, there are talks na Pfizer cannot be stored here because we are in a tropical country. Philippines is a tropical country. It's very hot in here. Just last week, it was 38 degrees Celsius. And logistically speaking, storing a vaccine that needs to be on a negative 75 degrees Celsius freezer is not, it's not efficient enough. It's either masyado siyang mahal to buy a freezer na kayang i-cover yan, or masisira yung vaccine. So, sayang. So, I heard na yung dapat na Pfizer vaccine na mapupunta sa Philippines, napunta sa Singapore. So, that's what happened. So, possible side effects of Pfizer and Moderna. There may be pain at the site of injection, body chills, feeling tired, and feverish. So, that is very normal. Sa lahat ng bakuna, kung nakapag-experience na kayo ng flu shot, halos pares lang sila. I remember when I had my flu shot, parang almost 3 days masakit yung yung arm area ko, yung arms ko kasi nandun medyo malakas yung vaccine na nakuha ko. Okay. So first dose can last for up to 16 weeks or 4 months immunity. Nasagot ko na kanina. Let's see. Okay, let's go to AstraZeneca. What time is it? 8:59. AstraZeneca, it came from the UK. It's a viral vector. Kailangan natin ng 2 doses about that to get the full dose. Storage is about fridge temperature, 2 to 8 degrees Celsius. And how effective? malaki 62% to 90%. So, ang nangyayari dito, nung nabasa ko, ang sinasabi, 62%, yung efficacy rate niya kapag nakuha mo yung first dose. And then, kapag nakuha mo na yung second dose, magiging efficacy rate niya is 90%. So, yun yung nabasa ko about AstraZeneca. However, ang nangyayari with British Columbia is because of that side effect na thrombocytopenia or blood clot, pinull out na siya. Kasi before, di ba, it's not feasible for people below 65. Tapos about a month ago, about 3 or 2 weeks ago, pinull out din siya for 55 and below because of that side effect. So ngayon, ang age range na lang is 55 to 65 years old. And then, baka tinatanong nyo, bakit napaka-specific ng 55 to 65 years old? Bakit hindi na nila pinull out completely? So we're gonna talk about that later sa question and answer. Meron na akong sagot dyan mamaya. Side effects. Parehas lang din siya with Pfizer and Moderna, pain at the site of injection, body chills, tired, and feverish. So that means kapag yan ang nararamdaman nyo, ang body nyo is making that protection para maprotektahan kayo against this virus. So meron tayong Johnson & Johnson. It is not in British Columbia yet. So as of now, 3 lang meron tayo. Maganda sana itong Johnson & Johnson because isang dose lang to eh. The other 3 are 2 doses, and then this one is just 1. Tapos, very easy lang din siya to store kasi fridge temperature lang siya. Same lang din siya ng side effects, same lang din with the other 3. So let's talk about COVID-19 variants. Okay? Ito yung medyo nagpapa-alarma sa ating lahat kasi biglang taas na naman ng cases natin, whether it be in Canada or in the Philippines. So, ito yung sinasabi nila, mas gusto ko sana yung yung variants na lang, mas madali siyang intindihan pag binabasa siya sa news kung ang nilalagay nila is yung country. But they use the scientific name, I guess, for some reason. So with UK, para lang malaman nyo, it's B117. Ito siya. Ano pa siya? It spreads more easily and may quickly increase the number of cases. Nakita natin yan before kasi ang daming cases, a month ago, ang daming cases from UK. Tapos biglang dami siya. And then from South Africa, ang tawag sa, or B.1.351, it spreads more easily and may be able to hide from the body's immune system. So this one, medyo nakakatakot kasi marunong siyang magtago. But I think siya yung third dun sa cases ng variants natin. And then itong sa Brazil, or P.1, mas nakakatakot to kasi it can reinfect people who already had COVID-19 at saka mas mabilis siyang mag-spread. So ito yung tinitingnan. Well, itong tatlong to, tinitingnan ng BCCDC kung ano yung galawan nila. But with Brazil, mas nakakatakot kasi kahit nagkaroon ka na ng antibodies, kahit nagka-COVID ka na before, pwede ka ulit magka-COVID. And then the fourth one, Nigeria, B.1.525. Hindi siya kasama sa BCCDC, but this is good to know just in case na biglang labas or biglang taas ng cases ng variant na to. Katulad siya lang from South Africa. It may also be able to hide from the body's immune system. So, total variant cases. Last month, nung pinesent ko to, it's only 246. Tapos, as of yesterday, biglang taas siya ng 5,230. This is across BC ha. And this is all time na siya. I wasn't able to get just this week. Pero imagine nyo naman yung increase. It increased exponentially. Ganon kabilis yung mga variants. So, paliwanag ko lang kung ano yung variants pala. With variants, tinatawag natin siyang mutants. Kasi may dalawang may dalawang sa science, meron tayong tinatawag na virus and may tinatawag tayong bacteria. So with bacteria, madali silang, kapag nalaman natin sa bacteria, madali siyang matreat kasi may antibiotics. But with virus, kaya nahihirapan ng buong mundo to treat virus is because wala tayong cure. Walang wala tayong gamot para sa virus. Kasi ito yung tinuturo nila sa nursing school. Ang virus, kahit mapadengge yan, mapa-flu yan, trangkaso, ang kailangan natin gawin is increase our immune system. Kailangan natin magpalakas. Walang gamot. Flu shot is good. Although one of the things about virus is that it is mutating. Ibig sabihin ng mutating, nag-iibang anyo siya, kumbaga. Palit ng dami. So, minsan, mas lumalakas siya. So, ang variant or mutant virus in COVID-19, ganun ang nangyari. Mas tumatalino. Nagiging mas matalino sila. And therefore, mas nahihirapan tayong sugpuin yung cases or yung COVID-19. So, as a community, what can we do about these variant cases? We will answer that in a few more slides. Let's just go to COVID-19 immunization plan. So, tapos na tayo sa phase 1 and 2. Right now, we're in phase 3. Makikita nyo to sa BC government website. Kung meron kayong parents or grandparents, dapat may first dose na sila around up until the end of April or in May. So Indigenous peoples, they're also a priority, age 18 to 64 years old. And then people aged to 16 to 74 who are clinically extremely vulnerable. So gusto ko lang ipaliwanag kung ano yung clinically extremely vulnerable, or CEV. So yan yung mga tao na may sakit, may pre-existing conditions. Hindi lang yung basta-basta ng sakit. Yung mga kailangan kumuha ng COVID-19 vaccine na may CEV, those are the people na mayroong cancer, nagda-dialysis, nagkaroon ng organ transplant. Ano pa ba? Yun lang naalala ko for now. But if you go to BC government website, as you can see, pwede niya siyang i-click para makita nyo kung ano yung mga clinically extremely vulnerable. These vaccines, itong apat na vaccine na to, I think with Pfizer and Moderna, they can only be given for people who are 18 years old and above. Tapos ang AstraZeneca is for before 16 years old and above, before that pull out. So ito yung sinasabi na, again, with 16 to 18 years old, medyo ano pa sila, minor. So it is important for you to talk to your child or to your child about vaccines para alam din nila or informed din sila about the COVID-19 vaccine. So phase 4 malapit na. Ito na yung mga middle-aged adults and young adults. I think if you go to the website, BC government website, there is a link na sinasabi dyan sa baba na you can register. We can, sa next slide, meron tayong mga schedule. So ito na nga, dito ko kinuha yung information. Get vaccinated from Government BC. So how to get vaccinated for COVID-19? Yan. So meron tayong tatlong steps to do the vaccination. One is to register. So right now, you can register if you were born 1971 and above. Kung indigenous ka, 2003 or earlier. Tapos, yan na, may question mark yung clinically extremely vulnerable, but nasagot na natin. You can with people na pinanganak 1976 or earlier, pwede na kayong mag-register April 16th at 12 p.m. Ngayon yan. Ngayon, pwede na kayong tumawag. For people na millennials, 1981 or earlier, pwede na kayong tumawag next Monday, I believe. 16, yeah. Monday, tawag na kayo to be registered. So ano nangyayari pagka na-register na kayo? Of course, kailangan nyo ng appointment. So, ang appointment, hindi kayo mag-a-appointment. Tatawagan kayo. So sabi dito, we contact you when you are eligible to book a vaccine appointment based on 3 factors: your age, the plan phases, and the vaccine supply. So yan. Don't expect to book an appointment the same day you register. Hindi sa fast track. So here, there are 3 steps to get vaccinated. Step 1, register. Meron tayong 3 ways to register. And then step 2, book an appointment. Pero again, booking an appointment, sila ang tatawag sa'yo. Hindi ikaw ang tatawag sa kanila. Step 3, get the vaccine. The first dose and the second dose. So ito na yung first way to register. This is the easiest one, especially kung meron kang MSP or personal health number. Minsan, siya, separate card siya, but usually nasa likod na siya ng driver's license mo. So online registration only takes 5 minutes. Make sure that all of these information, meron ka na niyan, first and last name, date of birth, postal code, your PHN, and then yung mo talaga, yung email address mo na lagi mo check. You have to make sure na hindi ka magbibigay ng other confidential information mo. Hindi nila yung SIN or your driver's license number mo or your banking and credit card details. You don't give that away. Ito lang na na 1, 2, 3, 4, 5 information lang. So, ano nangyari? I don't have a personal health number. Wala akong MSP. I'm a tourist na stuck here. You can register by phone. You can call this number, 1-833-838-232. So, I want here. Sorry po, meron pong hindi naka-mute. Okay, let's go on. If kailangan nyo ng nagsasalita ng Tagalog or Filipino, translators are available. You can always ask for them. They are available 7 days a week, 7 a.m. to 7 p.m. Pacific Daylight Time. Or kung kung may malapit na Service Canada sa inyo or Service BC office sa inyo, you can go there and register in person. And after that, kapag ginawa
register the boulder so they can hear us.
Don't forget to get your confirmation number after you register. And do not lose that number kasi very important yan kapag dating ng appointment date nyo. Alright, so immunization clinics. It is being organized in 172 communities in BC. Hindi lang siya sa mga hospitals or sa walk-in clinics. Pwede siya minsan sa school gyms, arenas, convention halls, community halls, mobile clinics. So siguro kung pwede minsan religious churches, if they volunteer, maybe pwede din yan, just like with voting, diba? So kapag dating nyo, ito na yung mangyayari, what to expect at the vaccine clinic. Kailangan prepared kayo pagdating nyo. Unang-una, I highly suggest na mayroon kayong sapat na tulog, you are well hydrated at nakakain kayo para mas okay yung pakiramdam nyo at hindi kayo masyadong natatakot, hindi kayo yung manginginig pagdating nyo dun sa clinic. Make it as easy as possible for you. Wear a short-sleeved shirt and a mask and arrive a few minutes before your scheduled appointment time. So, sinasabi dito, a few minutes before, pero wag sobrang aga. Kasi, ang sinasabi ng BC government, nabasa ko, kapag sobrang aga nyo dumating, ibig sabihin, mas mapapadami or mas mapapataas yung chance na ma-breach yung social distancing. So, few minutes lang. I would say mga 5 minutes early. Pwede na yon. Pero 15 minutes early, masyado siyang maaga. And you can bring one person with you for support. All clinics are wheelchair accessible and you will be provided a mask if you need one. And during the appointment, may check-in process kayo. You can either decide or choice will not be offered. And then, kailangan may observation area kayo or nando kayo sa observation area for 15 minutes as is with other vaccines para lang makita kung merong severe side effects. You can expect to be at the clinic for 30 plus 60 minutes in total. Just to let you know, nabasa ko to, usually kasi with vaccines or any other health procedure na ginagawa, meron lagi siyang consent, informed consent na pinipirmahan, di ba? But nabasa ko from Immunized BC na as of right now, there is no signed informed consent. Meron verbal consent, and then possibly pag in the future, in the near future, the pharmacy can give the informed signed consent. But right now, wala siyang ganun. I was trying to find out why it's like that, but so far wala akong makitang sagot. If you still have questions about other non-health related information and services related to COVID-19, you can call 1-888-COVID-19. Available sila from 7:30 a.m. to 8 p.m. Ito na, dito na tayo. Frequently asked questions. Marami-rami to. I heard the vaccines were rushed. Is it safe to get it? Yes, it is safe to get it. As nakita natin kanina, hindi basta-basta nag-release at nagdi-distribute ang Government of Canada ng vaccine nang hindi thoroughly napag-aralan. And then maraming gateways or gatekeepers ang vaccine. Meron tayong ethical board na tinatawag, meron tayong institutional review board, and then meron pa tayong NACI na tinatawag. I think it's National Commission on Immunization, National Advisory on Immunization. Second question, can I finally travel to the Philippines after getting the shots? You know, the answer to that, it changes every time, basically. With that, you have to check 2 immigration offices, Canada, the Canadian one, and the Philippines one. Right now, with Philippines, nobody's allowed to go inside, or to be admitted in the Philippines kung wala kang Philippine passport or kung hindi ka OFW. Can I take my mask off and stop social distancing after getting the vaccine? Unfortunately, we can't yet until we reach the herd immunity. Kasi hindi natin alam, tayo protected, pero paano kung carrier pa rin tayo ng vaccine? Paano yung vaccine na yon? Pag nakita natin yung friends natin or yung lola natin or anyone na hindi pa na-vaccinated, baka mabigay pa natin sa kanila yung virus. Should I take ibuprofen or acetaminophen, Tylenol, or Advil kapag may side effects sa COVID-19? Ang sabi is, it is not advisable kung 18 years old and below ka. Pero in my nursing perspective, I would suggest na let the vaccine take its course, na parang give your body the time na makapaggawa siya ng sarili niyang protection against the vaccine. Pero kung hindi mo talaga kaya yung fever or yung muscle pain or yung sakit, you can take Advil or Tylenol. Can I choose not to get the vaccine? Of course. It is, again, your personal right. It is your constitutional right not to get the vaccine. But I highly suggest for us, for everyone, for your own safety, for your own protection, your family and your community, I am highly hoping for everyone to get the vaccine. But again, it's your choice to get it or not. If you have other questions, you can go to immunizebc.ca. Andun yung mga questions. Pero marami pa to. Next tayo. Okay, these are all lumped in one. So, can anyone living in BC get the COVID-19 vaccine? What if I don't have health insurance? What if I am a visitor from another part of Canada or another country? What if I don't have MSP or a PHN? Paano kung international student ako? Paano kung hindi ako PR? So, napag-usapan na natin yung kanina. Anong sagot? Pwede ba silang makakuha ng vaccine? Kahit wala silang health insurance?
Yes.
Yes.
Perfect, yes. Kahit international student ka, kahit napasu yung work permit mo, you can get it. Walang exemption dito. So next one. How can I confirm the time and or location of my COVID-19 vaccination appointment kung nakalimutan ko? So kung nakapag-register ka and book your appointment, you can call 1-833-838-2323. Pakilista po ito or screenshot or take a picture para hindi nyo makalimutan. Pero kung yung vaccine nyo kukunin nyo from pharmacy, you can call the pharmacy. Pero if it's from a health authority, please call the phone number na to, itong 1833. Okay? Next tayo. So, hindi ako nakakuha ng confirmation email after registering for my COVID-19 vaccine. Anong gagawin ko? Minsan, napupunta siya sa spam folder. So, check your spam folder sa email mo. Or minsan, kung wala din pala sa spam folder. So, baka nangyari may typo error dun sa email mo, hindi ka rin nakakuha ng text, baka kasi mali din yung phone number. So, again, call this number 1-833-838-2323 to confirm your email address or your number if your age group is eligible to register. Sorry, I'm just gonna put myself on my earphones. Can you hear me? Hello?
Yes.
Can I hear me?
Yes.
Perfect. So next, if I have been told I am a contact or na-expose tayo sa COVID-19, pwede ba akong magkaroon ng priority access sa vaccine para hindi na ako magkasakit? So kung na-expose ka na, parang, hala, baka magkasakit na ako. So, hindi pa rin po, ang sagot, no. Because, again, ang napag-usapan natin kanina, the vaccine takes 2 weeks to work. So, it does not treat, hindi niya tinitreat or lessen your symptoms. Kung ma-expose ka at magkakasakit ka, magkaka-COVID-19 ka talaga. Yun, so the vaccine would only provide protection after it starts to work. Hindi siya treatment kung nagkaroon ka na ng COVID-19. So there is not an option to get early access to the vaccine if you have been exposed to COVID-19 disease. So ang best thing to do for this is to have yourselves protected. Always wear a mask. Kung single-use lang siya, please just use it single-use. Huwag nyo nang gamitin yung surgical mask. Huwag nyo nang gamitin araw-arawin. If you've used it for 8 hours, throw it away. Have another one. Pwede din naman yung wearable or washable. And then always wash your hands or always have alcohol or sanitizer with you. Ito. So, question natin kanina, bakit ang PC gumagamit pa rin ng AstraZeneca? Ngayon may bago na siyang name, Covishield, in people over 55 years old. So ang sabi dito, these blood clotting events appear to be even rarer in this age group. So usually kasi kapag 55 years old ka na, may maintenance ka na na gamot, aspirin, para sa blood thinners. So medyo rare na siya na magkaroon ka ng thrombocytopenia. This was answered though on March 31st, 2021. So pwede siyang magbago given the nature of this pandemic. So next one, if I got my first dose of the AstraZeneca or Covishield vaccine, should I get the second dose or will I get a different vaccine? So kung below 55 years old ka, tapos nagkaroon ka na ng first dose ng AstraZeneca, nakapause siya for second dose and for people under age 55. So kapag after 16 weeks, if these vaccines are not recommended for you when it is time for your second dose, public health will assess the latest information at magde-decide sila sa type ng second dose that you can receive. So I'm guessing meron silang ongoing research kung ano ba yung pwedeng ibigay na second dose for those na na-pause na-pause yung AstraZeneca vaccine nila. So medyo medyo messy siya ngayon kasi as you can see, we're all navigating this trial and error. So ito, last question. Second to the last question. After vaccination, will I be protected from the variant strains? Ano pong sagot? May nakakalam po ba?
No.
Pwede po maghula lang.
No.
Yes.
No.
No.
Yes and no.
No. No. No.
Medyo complicated yung sagot eh. Ang sabi po sa mga research and even with the BC government website and with the WHO as well, with the variant strains, ongoing po ang research nila kung fully protected kayo or fully protected kayo ng vaccine. So say for example, nabakunahan kayo ng Pfizer, will I be protected from the variant strains? Ang sinasabi po ng WHO is mababawasan yung risk nyo para magkaroon ng COVID-19. Remember, with Pfizer, 90% ang efficacy rate niya doon sa old COVID-19. Pero po, with after vaccination, with kung nakakuha ka ng variant, say for example, yung Brazil variant, may possibility na makuha mo siya, pero magkakaroon ka lang ng milder symptoms. Ang sinasabi ng WHO, the goal right now is to prevent further death and severe infection. So ulitin ko po ulit ha. After the vaccination, ang goal po right now, kung with the variant COVID-19 viruses, ang goal po ng vaccines is to lessen the symptoms, lessen the rates of death, and lessen po yung mga severe infection and illnesses. Yan po. Yan ang sinasabi ng WHO. Okay, next tayo. Last one. Will I be able to choose which brand and type of COVID-19 vaccine that I want to receive? Can I pick the best, most effective vaccine? So sabi po ni Dr. Bonnie Henry, and I fully support her on this one, the vaccine you are offered is the best medicine or the best vaccine. Ang sinasabi nga po nila, hindi naman yan i-approve ng Canada kung hindi siya safe for everyone. Just for a segue po or a side note, kahit po dito sa Pilipinas, Sinovac's efficacy rate, kasi yan po available from the government, efficacy rate is about 50%. I still highly encourage everyone to get Sinovac kesa wala. Kasi at least 50% you are protected. Imagine if you're not protected at all, at least binibigyan mo ng chance yung katawan mo para maging protektado kahit kalahati lang. So yan po ang aking encourage. But again, this is a personal choice. You can always say no, you can always wait for more research. It's a personal choice. So yun po ang mga frequently asked questions na nakuha ko na I feel like everybody will have in their minds right now. So vaccination aftercare, please take a screenshot of this one. Napag-usapan na po natin to kanina. Dito lang po tayo sa may gitna, tips for side effects. Kung masakit po yung area ng vaccination, cool damp cloth or wrap ice pack. Yan po tayo. Okay, so any other questions? Open forum na po tayo. Meron po tayong half an hour.
Okay, thank you so much, Joy. That was a very detailed and lengthy presentation about COVID-19 as well as the available COVID-19 vaccinations, how they are different from each other, the possible side effects, and many others.